If you suffer from acne, you know that one thing that's worse than acne is acne scarring. Now, I'm going to show you exact routine I've used to treat thousands of patients, including myself, to fix your acne scarring. I'm Dr. Brown. I'm a board-certified dermatologist. I myself suffer from acne, and I have treated many patients for acne and acne scarring. In this video, we're going to go over some treatment options for your acne scarring, how to prevent acne scarring to begin with, and how to safely treat them with some at-home treatments. Now, I'm going to back up just a little bit, talk about why you get acne scarring. Most patients will call hyperpigmentation actual scars. Hyperpigmentation is the dark mark you get after you've had a pimple there for a while. The darker your skin type is, the bigger that pimple was, and the longer it was there, the longer the dark mark is going to be there for. Hyperpigmentation is not as difficult to treat as the actual scarring. Hyperpigmentation, which are just flat, and hyperpigmented, aka dark marks, they're usually flat. So things like topicals that we discussed, like alpha hydroxy acids, beta hydroxys, and retinoids work by exfoliating, and they do a pretty good job at taking care of it. Actual acne scars typically have some sort of indentation. There's different categories of acne scarring, and those not only have pigmentation issue with them, but they have texture change and they're indented. So not only do you need to peel off the top layer of the skin to help minimize the appearance of it, you also need to work from underneath to help build collagen to minimize the indentation of that scar. So the scars that have texture change to them are just a little bit harder to treat compared to the scars that are really just hyperpigmentation. They're flat but discolored. This is what you need to be prepared for in your acne scar treatment journey. So one of the most important things with acne scarring is it's a process. You're not going to pick one treatment and just do it one time and it will be done. Acne scarring didn't happen overnight. It's not going to go away overnight. Most of the time, because of cell cycle turnover being about 28 days, you're going to want a treatment every 28 days or about every month and give it about 3 months. After that, you should start seeing anywhere from 20 to 60% improvement. I know that's a big range and everyone responds differently, but you need to plan on about 3 treatments, about a month apart at minimum, before you notice any improvement and are able to say whether that treatment is going to help you or not. One of the things to consider, if you're darker complected, darker skin type, your process of acne treatment may require multiple sessions, more so than a lighter skin type. And that's for a couple of reasons. One of the main reasons is that darker skin type tends to be a little bit more sensitive and a little less room for error with the treatments. So you need to err on the side of caution with the strength of acids that you're using, the depth of needles that you're using to treat those, and therefore patients with darker skin may need multiple treatments to see the same results. Let's get into the topical treatments, because that's one of those things that's really easy to get you. You can get your hands on sometimes over the counter. These include things like mandelic, lactic, glycolic acid. Then there's also beta hydroxy acids. This is salicylic acid that can be used to treat acne and hyperpigmentation. And the third one is the retinoids. So retinoids also work by exfoliating the top layer of the skin. Really, step one is wearing your sunscreen every single day. When that pink scar is healing, if it's exposed to UV radiation, it's going to turn brown and it will stain your epidermis, and it's going to take a lot longer to get rid of it. So making sure you're wearing sunscreen every morning is crucial step one in treating scarring, period. Then let's get into the topicals. So in the morning, you're going to do your sunscreen. At bedtime is when you're going to use your hydroxy acids and retinols, primarily because they work by exfoliating the top layer of the skin, so they're going to make your skin a little more prone to sun. You're going to be more prone to sun in the morning, even though you're applying your retinol or alpha hydroxy acid at bedtime, because it has exfoliated the top layer of the skin, and that new skin on the surface is more prone to UV radiation and sensitive to it. If you're going to use your topicals at bedtime to treat your acne scarring, it's important to make sure that you're not mixing them all together in the same routine. For example, your alpha hydroxy acids are lactic, mandelic, glycolic. They work by exfoliating the top layer of the skin. So does your retinoid. If you apply alpha hydroxy acid or beta hydroxy acid and a retinoid all in the same acne skincare routine, you will experience excessive irritation, which can further result in hyperpigmentation, and you can make your hyperpigmentation worse. So to treat those scars, you really want to make sure you're giving your skin opportunity to heal itself. So what I typically recommend to my patients is applying alpha hydroxy acid on one night. Next evening, if your skin is not irritated or dry, maybe you do retinol that night. If you do develop irritation from these treatments, take a step back, listen to your skin. If you wash your face at bedtime and it is dry, peeling, and really tight, skip a night. Don't use your retinol, don't use your hydroxy acids that night, just moisturize. And then next night, get back to it. Another way to approach this is by skin cycling. Do alpha hydroxy acid one night, beta hydroxy next night, retinol next night, then moisturizing night or recovery night. It's really not a cookie cutter. It really depends on what your skin type is and how you respond to the treatment. So if you're not dry, you can just alternate them nightly. But if you are dry, feel free to take a break and let your skin recover before you get back to it. Some of the brands and examples that I have personally used or recommend to my patients, if we start with the milder ones, Ren Skincare carries a lactic acid toner that's really nice. It's gentle on your skin. So if your skin is really sensitive and prone to rosacea and breakouts, this is a good one to start. Apply a small amount to your face at bedtime and feel free to moisturize on top. Next is glycolic acid, and this is the GOAT. Glycolic acid from The Ordinary is really nice. Applying this at bedtime will also help exfoliate the top layer of the skin. Now be cautious if you have rosacea or sensitive skin, it may cause some irritation. So you can apply to a small patch on the jawline and just test it one night and see how you do with it before you apply it to your entire face. If you're really set out to do glycolic acid and it really irritates your skin, another way to approach it is to do short contact therapy. So instead of applying it to your entire face and sleeping with it, you can apply it, leave it on for a couple hours, and then wash it off. And you can increase the potency of this treatment by increasing contact therapy with the glycolic acid if you don't tolerate it. Now, if you're doing your retinol night, for retinols, there's a variety of them. So if you start over the counter, there's Rock, Neutrogena, La Roche-Posay, CeraVe. They all have really good retinols. They're going to be the mildest category, retinol. The next category is going to be your retinols. Retinol is converted to retinol on our skin. So if your skin has tolerated retinol or you're not irritated at all, you can go ahead and just get a retinol. So really the brand on the front doesn't matter as much as the active ingredient. Now we moved from retinol to retinol. Retinol on our body is then converted to retinoic acid. This is the tretinoin. This is what everyone talks about nowadays, the most popular thing to put on your face. Tretinoin is only available by prescription. It comes in different strengths. If you're seeing a dermatologist, they will write you tretinoin. This is how you're going to use it. You take a pea-sized amount, typically comes in a tube, pea-sized amount, half of the finger tip length right there. And you want to spread that into 4 dots and then spread it on your entire face. You never spot treat with the retinoid because you're trying to treat the whole face. When you're spreading it, make sure you don't get too close to the eyes or the corners of the nose, because what happens is this skin right here is very delicate, and retinol we talked about works by exfoliating the top layer of the skin, and when it does that, it can cause irritation. If you're developing a lot of irritation from your tretinoin or retinol, another way to approach it is by moisturizing first, or only applying moisturizer in those delicate areas such as around the eyes and a nose before applying your retinol. Retinol should be applied at bedtime. 1, it makes you more photosensitive, and 2, retinols are degraded by the sunlight. So if you're applying it in the morning going outside, it's just not working. Let's talk about office treatments and procedures you can do in your dermatologist's office. But before we do that, if you really like these topics, or if you have a particular topic you want me to talk about, let me know in the comments below. Or if you have questions about what I've talked about, let me know in the comments below. I want your feedback. If you're doing all your topicals and you're ready to do in-office treatments, here are some options. Now think of this as an add-on to your topicals. So I would not take an office treatment to be in place of your topical. Your topical treatments are going to be a must no matter what you're doing. If you think about it as a pyramid, your skincare that you're doing to treat those acne scars is down here. Your in-office treatments are at the top. If you don't have the bottom, the top falls down. So you really have to have the skincare in addition to office treatment. If your scars are completely flat and they're pink, the best treatments for that are IPL or pulse dye laser. Pulse dye laser is my favorite. It really is a true laser, targets the redness. It works really well, a couple of treatments, and those scars are virtually gone. If your scars are brown or hyperpigmented, laser isn't going to do amazing for that because that pigmentation is so deep underneath. This is where your skincare comes into play, and chemical peels. Glycolic acid works well, Jesner works well, salicylic acid works well. I would recommend you try an in-office treatment with a skincare professional, with an esthetician or a dermatologist when it comes to chemical peel before you go on your own and do this at home, because the in-office percentages of these acids are typically higher, and it is safer to do them in the office first time. Now, if your acne scars have any sort of texture changes in them, like indentations or elevations, the treatment's going to require more than just chemical peels and topicals and lasers. This is where microneedling comes into play, fractionated non-ablative, and then fractionated ablative lasers. Microneedling is a procedure where it requires topical numbing. This is very different from your at-home microneedling. And then the microneedling device goes in and out of the skin at a really fast pace. There's multiple needles. The provider who's doing the procedure for you can set the length of the needle and the depth of the needle to desired depth based on the location in the face and the type of a scar. The needle going into the second layer of the skin, into the dermis, creates micro injury to the collagen, stimulating collagen growth and shrinking that scar a little bit. I typically recommend patients start with microneedling. It's inexpensive, it's effective, and I recommend my acne scarring patients start with 6 of those treatments spaced 1 month apart. Lasers are going to be typically just a little bit more expensive than microneedling. Non-ablative lasers are going to have less downtime, also less results. Some of the examples of non-ablative lasers are things like your erbium, your Fraxel. Ablative lasers are things like CO2. If you decide to do laser, you will still need to do multiple sessions with the lasers, and how many you need and how far you're going to space them apart will be up to your physician to determine based on your skin type and your skin sensitivity. If you decide to do chemical peels, remember, doing your skincare at home and making sure you're wearing your sunscreen every single morning is extremely important. Chemical peels will take at least 3 treatments month apart for you to notice any sort of improvement in the pigmentation of the acne scars. If you're doing microneedling, minimum 3 treatments. Honestly, I typically recommend 6 treatments spaced about a month apart, and patients have had excellent results with this. Keep in mind, as we get older, our dermis thins out and skin thins out, and the acne scarring from your 20s becomes just a little bit more prominent. So all these treatments with the acne indented scars are going to be a maintenance thing. So when you're in your 20s and 30s, you may want to do just a few more microneedling or laser treatments to maintain those results. Now, the best treatment for acne scars is prevention. Treating your acne is extremely important. I have patients come in and they want to treat acne scarring, but they still have active acne. You can't do microneedling if you have active acne. Or if you're completely clear, you've done your 6 microneedling or chemical peel treatments, and your skin is clear, now's the time to start fresh, to not make those mistakes again so you don't have to go through the whole process again. Most women specifically, if we've ever had acne, we're probably going to break out with acne again. So just because you've had acne, you've cleared up your acne, you've cleared up your acne scars, doesn't mean you're out of the woods, because your body changes and hormones change and acne surfaces again. So making sure that you're maintaining that skincare so when that does happen, it's not as severe, you're going to have less scarring. For maintenance, for acne prevention, I typically recommend continuing with your retinol at bedtime, no matter whether you're using your retinol, your tretinoin. Think of it as your goat that's going to help you not only with acne, but fine lines and wrinkles and acne scarring and hyperpigmentation. Everyone should be doing it. Before you start the retinol, though, you have to do the sunscreen. So sunscreen every morning and retinol every night are going to be your 2 things. They're going to keep your skin clear and help prevent you from making that mistake of developing acne again and acne scarring. Now, let's say you break out from time to time, you get a pimple here and there. I know what we all like to do. You like to squeeze it so good when it hits the mirror. It's so satisfying. Please don't. Think of that pimple as a juicy red ball on your cheek. And when you're squeezing it, what you see on the surface is just tip of the iceberg. You're not seeing the whole thing underneath. So when you squeeze it, there's about 50-50 chance that it's going to do what you really want it to do and come out that way. But there's a 50% chance or greater it's going to pop underneath and you're going to create big inflammation. And now your body's coming in and trying to heal all that. And when it's healed up, that's when you end up with an indentation. So don't squeeze them. Don't pick them when they're healing. Instead, pimple patches. They're everywhere now. They're easy to find. You can find some with salicylic acid, with tea tree oil in them, or just plain hydrocolloid ones are my favorite. Neutrogena has some really nice ones. Put them on before you go to bed. After you wash your face, sleep with them. You will be surprised how that pimple has shrunk overnight. I hope this video helped you feel more comfortable with treating your acne and treating your acne scarring. I know it can feel overwhelming. If you like this, follow me on Instagram and TikTok, or comment below if you have any questions. And when you're looking for me on Instagram and TikTok, it's Dr. Aleksandra Brown. It's A-L-E-K-S. Us Bosnians, we don't spell things the way Americans do. So it's K and S, no X. Thanks for watching. Don't forget to like and subscribe.
3, 2,